it comes from a perspective that I gained very early in my career when Dr. Reed, Omar Reed, many of you have heard me talk about Dr. Reed. Dr. Reed was a tremendous mentor for me and will continue to be a mentor throughout my life. Dr. Reed said early in my career, he said, Gary, always remember that the hygiene department is the backbone of a successful general practice. And Naren, he said it with such conviction that I believed it at the time. There was no reason not to believe it because he said it so strongly. But I believe it even more strongly now, over 40 years later. I believe it even more strongly. And the first thing that I would like to do is I would like to set a mindset for you, for our listeners. If any of you think of your hygiene department as a loss leader, I want you to flip the switch. Because if you think of it as a loss leader, it's always going to be kind of perceived as a necessary evil. Right, Naren? I mean, if
Yes.
the mindset is that this darn thing's a loss leader, then you're really not going to give the attention that it deserves. It's going to be a necessary evil. I want you to
Right.
flip the switch and change it from the perspective of a loss leader to a profit center. And not only a profit center, but your hygiene department also serves the very noble goal of helping your patients become as healthy as possible. In other words, if we can get your patients to visit your office on a regular basis, we're going to do two things. We're going to keep them as healthy as possible, and we're going to reduce their future dental expenses because you'll be able to catch things early. And so maybe the overriding goal for developing a hygiene-driven practice is to help more of your patients achieve the best possible oral health. Now, how's that for a perspective, Naren?
Yeah, I love it, Gary. I think when you change the way you look at things, the things you look at change. So I think if
Absolutely.
you most practices, if they think of it as a lost leader, they're not going to give it the attention it deserves. They're not going to get excited about hygiene. So everything is kind of downhill from there. So this is
Yeah.
awesome.
It's the downward spiral.
Right,
It's
right,
that gloom doom loop that Jim Collins talked about. When he talked about the flywheel effect versus the gloom doom loop, and that's really what I'm talking about here. The flywheel effect is getting the 5,000-pound flywheel to turn, and once you
right.
get it to turn, it creates so many positive byproducts. The opposite of that, the corollary to that, the opposite of that, was the gloom doom loop. And I would argue that that same concept applies here. Hygiene, as a profit center, is the flywheel effect. Hygiene as, the loss leader is a gloom doom loop.